Welcome to this presentation of the top 10 cost reduction execution barriers facing healthcare organizations. My name is Brian Shannon. I'm the founder of Shannon & Associates, an independent consulting firm that partners with leadership teams in healthcare organizations to meet their cost reduction goals. Our success is very much driven by a keen awareness of what we see as the top 10 barriers healthcare organizations encounter with their cost reduction efforts. Our focus on overcoming these barriers with the 8 habits of highly effective cost management is the fastest and most effective path to improve performance. We can start with the elephant in the room. Let's face it, many leaders and organizations truly believe that they are running a tight ship, and that this opinion is the result of years of objective analysis. The truth is that opinions are the results of years of paying attention to the information which confirmed what you believed, while ignoring information which challenged your preconceived notions. This barrier, known as the confirmation bias, may deserve attention above all other execution barriers because it shapes our beliefs and contributes to so many of the other barriers to outstanding performance. So what does confirmation bias sound like in your organization? Well, we've already picked the low-hanging fruit. Or, in the words of the cartoon character Foghorn Leghorn, don't bother me with the facts, son, I've already made up my mind. Since we know we run a tight ship, any benchmark data that might suggest otherwise certainly doesn't apply to us. And again, since I know that I run a tight ship, any opportunities for cost reduction that might exist in the organization most definitely do not exist in my backyard. Investment advisors oftentimes warn investors about trying to time the market, to try to time their investment in the stock market, in and out of the stock market. And yet, quite often in organizations, we see that executives are trying to identify the perfect time to launch a cost reduction initiative. Do you have this tendency? What might this market timing look like and sound like in your organization? Well, first, before we pursue a cost reduction effort, we need to invest in technology, eliminate waste. We need to train our managers in lean. We need to improve throughput. We need to change the culture. We certainly need to get buy-in. And of course, we need to try to grow volume. If they build it, they will come. So trying to launch at a perfect time is another execution barrier. Do any of these apply to you? Confirmation bias leads directly to an activity bias, in which leadership teams conclude that they need to totally redesign the organization in order to get cost out. After all, we run a tight ship, we've picked the low-hanging fruit. We can't achieve results without adding something new. We need to push the envelope, people say. We need to bend the cost curve. We need to pursue game changers. We need big, bold ideas in order to reduce cost. What does activity bias look like in your organization? Well, as we've mentioned before, we've already picked the low-hanging fruit. So as one client puts it, since we've picked the low-hanging fruit, if you think we have FTEs just laying around here, you're sadly mistaken. So this seems like an innocent enough comment until we understand what this leads to. Since we've picked the low-hanging fruit, we must climb the ladder to go after the high-hanging fruit. And you can think of this as big, bold ideas, as they represent the only way to reduce costs further in these organizations. But what's the problem here then? The problem is that the successful execution of big, bold ideas is very low. There's a reason why the fruit is high up in the tree. It's tough to get to. It's tough to pick. Quite often, no results are found. And as a result of this, the failure to execute on these big, bold ideas leads to an endless loop in which bigger and bigger ideas are pursued, often with no results in sight. A Harvard Business Review article challenged the effectiveness of many performance improvement initiatives, with the author offering the following advice. Don't get swallowed up by the pursuit of activities that sound good, look good, and allow managers to feel good, but in fact contribute little or nothing to bottom line performance. Albert Einstein was quoted as saying, "Not everything that counts can be counted, and not everything that can be counted counts." If many of your departments are running at productivity levels of 100% or higher, yet your organization still has the need to lower cost, in all likelihood, you may be counting the wrong things. You might find, for instance, that the benchmarks on which some of the targets are set may have been cherry picked, or your folks may have too much discretion for changing targets. Further, if your organization remains focused on conventional measures of unit cost related to departmental activities and volume measures such as square feet, registrations, charts completed, inpatient procedures, and so forth, there's a strong likelihood that you're making suboptimal resource allocation decisions. Not only will you not be reducing departmental costs, you may actually increase hospital cost. Counting the wrong things can inflate your cost structure by as much as 5 to 10%. One of the first questions we ask clients is whether they've established a cost reduction goal. More often than not, the answer is no. That's okay as long as senior leadership understands that there is the need to set a goal. Absent a goal, I can promise you that you will be collecting bushel baskets of improvement initiatives with no results in sight. Now, sometimes a client will answer this question by stating that the goal will be determined by the outcome of a cost or benchmarking assessment. But linking the goal to benchmarks is a risky proposition because it exposes the integrity of the goal itself to all of the pushback that benchmark comparisons inevitably invite. Our view is that your cost reduction goal should stand on its own 2 feet and be based exclusively on your strategic needs and the capital required to support those needs. A goal based on strategy will then help your leadership team to communicate a burning platform and mitigate the inevitable pushback received when this goal gets parsed out in the form of targets that are eventually assigned to department heads and executives. Setting expectations through target setting that elicit superior performance is quite a challenge in many healthcare organizations. In fact, over a third of executives we've surveyed have identified target setting as their weakest link. Let's review what we see as the biggest target setting issues. First, not setting targets. Just do the best you can. Develop a cost reduction plan, but we're not going to set targets. Come back and we'll evaluate whether we feel you've done as good as you can do. Secondly, confusing benchmarks with targets. Benchmarks may be an input into the development of targets, but they're not targets themselves. Think of targets ultimately as the values that will be integrated into the budgeting process for ongoing tracking. Third, expecting buy-in to targets. But since most of us believe that we're running a tight ship, it's going to be awfully hard to convince us otherwise. Expecting buy-in to cost reduction targets is not realistic in most organizations. And if it is realistic in your organization, you're going to spend an awful lot of time getting there, and it will ultimately significantly affect the timing of the realization of savings. Fourth, the prevailing wisdom is that improvement initiatives come first. How can we set targets before we have plans in place? Our response, as you might expect, is that absent the targets, you will not get the level of management engagement and accountability needed to develop and execute the plans in the first place. And lastly, not allowing for slippage when setting targets. Slippage in the development and execution of plans is a reality, but oftentimes we're not factored into the targets themselves. So if you're an organization with a $10 million cost reduction goal, it may be essential for you to develop targets that add up to $12 million in the aggregate. One of the keys to success in cost management is sustainability. And so we oftentimes will hear the question, if we hire your firm, will our savings be sustained? But dependency on outside firms year after year will actually stunt the needed management development and execution capacity that's required to sustain results. Leveraging your in-house experts and hardwiring the disciplines and repeatable processes into your organization's DNA is the only path we know of to sustain results. We fully understand why an organization might wish to overweight its cost savings portfolio on supply and other non-labor savings, clinical performance improvement, service rationalization, and so forth, while underweighting its allocation to labor savings. On the surface, this would seem to preserve as many jobs as possible. However, before staking the success of your cost reduction effort, on these cost savings model allocations, it's essential to examine your own history of success and failure with cost reduction and to focus on what works in your organization. In our experience, the most tangible and auditable savings will always be a reduction in labor costs through FTE reduction and true productivity improvement. Lack of consideration of your risk-reward payoff will lead to a less than successful cost reduction effort. Wasting too much time with a cost reduction effort is barrier number 9. We find it noteworthy that while so many organizations have embraced lean concepts, they fail to apply these very same concepts to the cost reduction effort itself. What are the biggest time wasters on cost reduction efforts? Breaking the effort into sequential phases. Big consulting firms will usually propose breaking the work into phases, with the first phase being an assessment phase. This enables them to price the planning and implementation phases based upon the opportunities identified in the assessment phase. This phased approach ultimately lengthens the time to realize savings and increases fees as well. This phased approach is so common that many clients don't recognize that other approaches such as our seamless approach are even available to them. Secondly, diving into improvement initiatives before goals and targets have been set. Every organization has dozens of improvement initiatives they're working on, but the common refrain is that there are no results in sight. As tempting as it may be to dive into these initiatives, you'll have far greater success if you set the goals and targets first, so that these initiatives can be aligned with organizational accountability for results. Allowing too much time to develop targets and plans. This will directly impact how quickly your organization will realize the savings and might ultimately increase the cost reduction goal itself. Fourth, insisting the plans be developed before tighter position controls can kick in. How can we act on attrition if we don't know what our plans will look like? While this thinking would seem to make sense, it will significantly delay the timing of savings and may ultimately result in greater employee displacement. And it's easy to get too distracted by other fires and noise in the organization, and it's important that you stay the course throughout the process. There's no doubt about it that reducing cost requires patience, perseverance, and toughness at times. Toughness can sometimes cause us discomfort, as most of us tend to avoid the conflict that's associated with toughness. But lacking the requisite toughness will ultimately doom your cost reduction effort to failure. Where do we see the required toughness oftentimes lacking? In confronting tough questions, there are going to be dozens of questions on the minds of your leaders, managers, employees, physicians, and so forth. It's best to anticipate those questions and to answer them honestly and upfront to promote communications and transparency. Making divestiture decisions. While many leaders advocate for divesting of underutilized and unprofitable services and assets, political will, however, is oftentimes lacking to make these decisions. Pulling the plug on projects and initiatives that are not producing results. Are there pet projects and initiatives that are not producing results? Perhaps it's time to do an inventory and streamline these investments. Adopting a more disciplined hiring process. Most healthcare leaders surveyed believe that they have strong and effective hiring disciplines in place, but then they have difficulty explaining why their FTE count is growing more rapidly than net revenue. Shaking up this bias requires some toughness, which will produce significant savings and help your organization ultimately to minimize the potential displacement of staff down the line. And lastly, demanding better results of your leaders. In a now classic Harvard Business Review article, the author wrote, "The key to a company's turnaround is when management becomes committed to expecting higher levels of performance. The capacity to demand better results seems like such a simple thing, but in fact it may be the most universally underdeveloped management skill." Before you get too deep into your performance improvement, take some time to evaluate your organization's weakest links and the potential barriers that will need to be overcome. Let's quickly review. Confirmation bias, such as, we are running a tight ship. Looking for a perfect time to launch your cost reduction initiative. An activity bias, that is, the only way to get savings is through more game-changing initiatives, bigger, bolder ideas. Measurement bias, that is, counting the wrong things. Diving in with no goal. diving in with no targets or setting targets very slowly, looking for answers from outside the organization that oftentimes stunts the development of the execution capacity required for sustainability, lack of an appreciation of your risk reward payoff that can contribute to poor results, wasting time, which will ultimately affect the timing of savings, and lacking toughness, which will also compromise results. While the execution barriers I've presented here may appear overwhelming, challenging, and grim, there is a bright side. If you are willing to confront these execution barriers, you'll produce a huge impact and major gains to your organization. I encourage you to visit our website or call us to learn more about how we hardwire the 8 habits of highly effective cost management to overcome these barriers and produce lasting results. Not only will you experience far greater results than the pursuit of big, bold ideas, the discipline developed to identify your greatest barriers and overcome them will ultimately strengthen the organization's capacity to produce lasting results. Thanks for taking the time to watch this presentation of the top 10 execution barriers facing cost management in healthcare organizations.